Hi, this is Editing Me, and as I sit down and edit the video that I made with my friend in Switzerland, I realized that this video was really long, so I decided to make it into two different parts. So this is the first part, and I will link the second part down in the description. And then I'm going to have kind of technically a third part. It's not really a third part, it's going to be me just speaking about my reactions of experiencing working as a physical therapist in Switzerland, well, observing my friend work as a physical therapist in Switzerland, coming from the perspective of a physical therapist from the United States. So enjoy!
Hi.
Hi!
Hi! Let's have a start.
Okay. Hi everyone, my name is Christine. I am a physical therapist from the United States of America, and this is my friend
Christoph, and I'm physical therapist from Switzerland.
So we have been friends for like 9 years now. We met through the internet because we were both in PT school at the time. Yeah. That is why we started messaging each other, and this is the second time we've met in person, and it's been really cool to talk about our jobs and some of the similarities and differences between the two countries and how we practice physical therapy between the countries. So I thought it would be fun to make a video where we talk about some of the similarities between working as a physical therapist in the US and versus Switzerland. And if the camera is shaking right now, there is a cat that is jumping on the table where the camera is, so just ignore that. Just for reference, we both primarily work inpatient, so that's where most of our experiences from. Since I've graduated PT school, I have only worked inpatient. I've primarily worked in inpatient rehab, but I have also worked in acute care. I obviously know a little bit about outpatient, but it's not my area of expertise. So I don't know if you want to say anything about where you work.
Well, where I work, I do mostly inpatient and some outpatient. But in other establishments, you have to have maybe only inpatient, and others have like half a day inpatient, other half outpatient. So it depends. Myself, I do like maybe 1 or 2 outpatient per day, and I mostly do inpatient because it's what I like. And I have different pathology like strokes, amputees, respiratory, but I don't do pediatrics. I avoid that.
Me neither.
It's too specialized for me. I don't want to touch babies. I'm afraid that I will break them.
Okay, so first off, we'll start with the basics. The phrasing that we use, I don't know why, but in the United States we say physical therapy, and in Switzerland you guys would say
physiotherapy. Which,
as far as I'm aware, I think most of the world does that, and the US is backwards with everything. And
where the French, who's not physiotherapy, it's like kinésithérapeute.
Oh, that's complicated.
Yeah, and yeah, I don't understand.
Yeah, short story. One time I had a patient who was from Canada, and the wife and the friend were talking to each other, and they're like, oh, we're going to physiotherapy. And so eventually I asked them where they were from, and they're like, we're from Canada, but we've lived here for a long time. And I was like, oh no, I was just curious because you were saying physiotherapy. And they looked at each other and they're like, what do you say in the US? And I was like, oh, we say physical therapy. And then they're like, oh, we have to sound like Americans. We have to say physical therapy. It's kind of funny. But okay, next thing, we'll talk about the education, because that might actually be the biggest difference between the two countries. So in the United States, if you were to become a physical therapist today, you have to go to college, get your bachelor's degree in whatever you want to get it in, as long as you meet certain classes. And then you apply for physical therapy school, which is a doctorate of physical therapy, and it's a lot of schooling, and it is extremely expensive. I would say most people that graduate PT school have between like 90,000 and
The cat just jumped.
between $90,000 and $250,000 in debt to pay for physical therapy school, which is ridiculous, but that's our education. So
in Switzerland, you have schools, and it's a bachelor degree. You have a pre-selection of the school because there's too many people who wants to be physical therapists, and there's only like, let's say, maximum 40 places per school, so like 120 in the French part of Switzerland. The school costs is not that expensive. It's like 2,000 francs, if I remember correctly.
a year or total?
In total.
It's not fair.
It's not really that expensive. Maybe I'm wrong. Maybe it's a little bit more, but it's not. You don't get debts if you start physical therapy school in Switzerland, and it's 4 years and you end with a bachelor of physical therapy.
The next topic is getting licensed. So once you finish school and now you want to practice as a physical therapist, in the United States, before you can actually work as a physical therapist, you have to take a national board exam. And then in some states, you have to take a law exam. It varies by what state you're working in. But it is do I remember, 250 question exam, 5 hours. You get like an hour for each 50 questions, and then 50 of the questions don't count towards your exam, but you don't know which questions, and it is a very stressful test. I hated taking that. It's also very expensive. I think when I first got licensed in the state of Florida, it cost me close to $1,000 to get my license. So, what do you guys do in Switzerland? Because I don't remember.
So much less. Well, we do have physical therapy school. At the end of each year, we have our exams, and we have also some field work to improve our technical skills. And at the end of the 4th year, you have the final exams, and after that, you're a physical therapist.
You're good to go.
You're good to go. You just need to apply whatever you want, and you start the job.
Wow, that's crazy.
The only thing is that you have to work 2 years full-time in a hospital or in an outpatient facility before you can have a license to be your own boss and open your own physical therapy center. So that's the only requirement. Otherwise, you just apply whatever you want and start working. And it doesn't cost anything. The exams are free. I'm sorry.
Our exams in school are part of our tuition, but to actually take your licensing exam, you have to pay. And then if you want to get licensed, which is going to be kind of the next topic, if you want to get licensed in another state, you again have to pay a bunch of fees. So in the United States, you get licensed per each state. So I have my license in the state of Florida because that's where I've lived, that's where I've practiced. You have to pay the fee for that state license on top of when you take your board exam. You have to take your board exam, pay the fee. But then if you want to work in any other state, California, New York, New Mexico, wherever, you have to apply for your license in that state and meet all of the requirements in that state. And of course, you have to pay more money for that state, and each state has different laws, so there are certain situations where you might actually be able to get licensed in one state and not get licensed in another state. So like I remember learning in school, in the state of Florida, you're only allowed a maximum of 5 attempts to pass your board exam. And if it takes you more than that, you can never be licensed in the state of Florida.
Wow.
So even if you were able to get your license in another state that didn't have a limit like that, even if after that you go to apply in the state of Florida and they see it took you more than 5 attempts, they'll deny your application. You won't be able to get licensed there. So it's a lot of money, and it's time consuming and very annoying. But yeah, I'm guessing you don't have to be licensed against against. You don't have to get a different license in
No, well,
the cantons. The
no, not the
cantons.
cantons. Well, Switzerland is a really small country, and you don't need a license to work in another canton. It's like, it's part of Switzerland, so it doesn't change. It's not that far away from each canton, and the only thing that maybe would happen if it's a foreigner that comes working in Switzerland, and if he doesn't have a bachelor of physical therapy or a master of physical therapy but another diploma, he just need to write to the Red Cross, Swiss Red Cross association, to make his diploma and validate that he has the same skill as a Swiss physical therapist. Sometimes the Red Cross required a little paperwork or some field work, which is stupid because they're all already a physical therapist, but well, bureaucracy.
Do you have to take a language exam to actually be allowed to practice here, or would it just depend on the facility that you're practicing in?
No, you will apply only in a facility where you understand the language.
Because in the US, to actually get a physical therapist license, you have to pass an English exam.
No, that's just ridiculous.
Well,
I'm sorry, but I made my studies in a French school, so I do speak French. I'm also speaking Swiss German, and
English.
And English, of course, badly, but I do. And I applied in a Swiss German part hospital, and I could have had a job. It would have been a little bit a struggle for me in the beginning, but just not language exams. We had Italians who were coming in Switzerland to work. The French was really broke, but they improved. But as long as you can communicate with each other, it's okay.
Yeah, and so the last thing about licensing, which I guess you guys don't have to do, is in the United States. And as far as I'm aware, every state, it's every 2 years, but I might be wrong. But we have to renew our license every 2 years.
And you have to pay.
Yes, you have to pay a fee. I was going to say a fine, but it's not a fine. You have to pay a fee. And it's not the same date for each state. So I am licensed in Florida and Massachusetts, even though I've never been in the state of Massachusetts. And so in Florida, I have to renew my license by November 30th of this year. It's every odd year. And in Massachusetts, it goes by your birthday every 2 years. And then again, each state has a different requirement for the license renewal. So it has to do with your number of continuing education classes that you have to take. So like in Florida, I have to take 24 hours of continuing education every 2 years, and then there's certain requirements, like I have to take medical errors, and only 12 of them can be online, 12 hours have to be in person, and how do they know that you guys are keeping up with education?
Well, if you work in a cabinet, when you work in a outpatient facility, you're required to have at least 5 days of for studies per year. Was it clear?
Yeah.
So you have to upgrade your skill, but you're required to at least 5 days a year. If you're working like me in a hospital, well, it's not a requirement, but I can ask for any information that I want, like maybe like lymph massage, and if they have the money for it, they will pay me. So I just ask and get it, and I usually don't pay it, or I pay myself because I want to learn that.
Yeah.
So it's my budget, and after that I have a paper that proves I made that class, that school, that diploma or whatever, and I just give it to my boss or my future boss.
Yeah, and with the job paying, that is similar in Florida, although it really varies on your employer. Some companies will pay for your continuing education, some will pay for some of your continuing education, and some pay for none. It's all out of your pocket. And and I guess the last thing about the states that, I don't know if I've ever told you this, you might find it interesting. What you can legally do as a physical therapist varies by each of the states. So depending what state you're working in, you have to know what's in your Practice Act, what you can legally do.
No.
So for example, dry needling.
Yeah.
We cannot do it in the state of Florida because our Practice Act says that you cannot pierce the skin. But in many states across the United States, you're allowed to legally dry needle as a physical therapist. But in the state of Florida, it's not in our Practice Act. So whenever you go to work in another state, you might have to study the laws if they require an exam, but not all states require the exam. But at the end of the day, you have to know what you can legally do within that state, because if something happens and you don't know what's in your Practice Act, or you're like, well, in Florida I could do that, it's not going to work out well in court for you. So you really have to know what you can do in each of the states, which is like another a big one is like manipulation, like spinal manipulation. It varies by states with what you can do.
Really?
Yeah.
Wow. Well, here, no. Well, there's a basic, and it's almost the same in every canton of Switzerland. There may be some obscure lines because of dry needlings, because also physical therapists shouldn't pierce the skin, but it's a problem between the insurance and the physical therapists, but not because the state says that you have to do that, you have to do this. So mostly it's the same everywhere in Switzerland. Like you do spinal manipulation at this. If you're in Ticino, Swiss German part or French part doesn't change. I don't get it. You're weird. The Americans are weird.
So, speaking of insurance, I guess this isn't even something I thought of, but the insurance system is different between the United States and Switzerland. We have a huge mess in the United States with our insurance, and it is terrible. And I think the PTs that feel this more are the ones in outpatient, because me working in a hospital, I don't deal so much with the authorization with insurance. I have to deal with documenting towards a certain insurance, I guess is the right way to say it. Or some insurances you have to fight with more to get like equipment approved and whatnot. But in Switzerland, it's not a national insurance per se.
No.
There's different insurance companies. But is it kind of like one's like worse than the other? Like if you have one insurance company, they might cover more equipment versus the other, or is it everyone will pretty much cover the same thing?
Basically, as we do have some catalog of possibilities in physical therapy, mostly all insurance covers what we do. It's after if you do the insurance will maybe pay or not pay if you do an alternative therapy like chiropractic or like naturotherapy or homeotherapy. So that in that case the insurance can say no, we're not paying for that, or yes, we're paying for that.
See, and if we did that, we would be in trouble with our board because it's out of our scope of practice. Yeah. So that would be a whole other issue.
But physical therapy is because we have two kinds of insurance. We have the basic insurance and the complementary insurance. So the basic insurance, the physical therapy is in the basic insurance, so it's automatically paid. But something like acupuncture is in the alternative complementary insurance, and so the insurance may or may not be paying, so it depends on the insurance.
Yeah, and does each insurance like give you the same reimbursement for a physical therapy service?
Yes, yes.
So I know like in the United States, the like Blue Cross Blue Shield might pay, and I'm just completely making these numbers up because I don't know them, I don't work in outpatient, but say Blue Cross Blue Shield pays like $35 for a treatment, United Healthcare may pay $40 per treatment, Coventry might pay some other amount. The amount of money you get back as a therapist depends on what insurance they have.
Not here. Here you have just two kinds of, well, basic physiotherapy and complex physiotherapy. So basic physiotherapy costs like, I think, 45 francs. I'm not sure about it. And complex physiotherapy costs 77 francs. So that's the price of a session of physiotherapy. And after that you can add some supplement like swimming pool, like pediatrics, which add costs because it needs some special equipment. Complex, exactly. But at the end, I get the same money, and it doesn't matter which insurance it is.
Okay, so the next one is direct access. So if a patient wants to get physical therapy on an outpatient basis, do they need to see a doctor first and get a referral to see physical therapy for it to be covered?
Yeah.
So you can't just start treating a patient?
Technically we can, but it's never done, because we prefer to have the prescription of the doctor and a real diagnosis, and so it covers what we're doing also from the insurance if there's a mistake. And I forgot what I said, but outpatient could come without a prescription to the physical therapist and ask for something, but he will have to pay. For the insurance won't pay.
They won't cover it.
That's no patient comes directly to me and asks, I need something for my leg or something. No, you go to the doctor, you have a prescription, you do your physical therapy, and you get money back. So why waste your time and just go and lose your money and go directly to...
Well, so in the United States, if I remember correctly, I'm pretty sure all 50 states have direct access now.
Mm-hmm.
It wasn't like that when I graduated school. But again, if you see a physical therapist on direct access, it is legal. The PT can treat you, but the insurance is most likely not going to cover the treatment. You're going to have to pay for it out of pocket. But this is the big thing. Some patients have a very high copayment to go for physical therapy. Like some of them, it can be probably can be higher, but like $50 a copayment for the physical therapy session. And then sometimes it can be battling with the insurance to cover it. And in my opinion, it might just be easier to go to we call them in the United States a cash-based clinic. So physical therapists that have a cash-based clinic, they don't deal with insurance, they just take the cash.
Okay.
And you pay out of pocket, but it's at least I think it should be, if you're doing cash-based, you're going to have physical therapy treatment one-on-one, have more direct care. You're not going to have a therapist that is treating multiple patients at one time, which not all clinics are like that. But let's be honest, there are a lot that are like that. And so it might actually, in my opinion, be more worthwhile to go to a cash-based clinic, especially if you have a really high copay and the physical therapist that you're going to is seeing like 4 patients at one time. So that's my 2 cents. Don't kill me. So the next 2 things are might be some of the bigger differences that we notice based as what we do for practicing in the United States.
Or in Switzerland?
Is respiratory and wound care. So for respiratory care, we learn respiratory care, at least I learned respiratory care when I was in school. I learned how to suction trachs, but I have never done that a day in my life as a working physical therapist. I don't know anyone who has done that. I imagine there are hospitals somewhere in the country where it's still, or skilled nursing facilities somewhere in the country where they still do that, but we have respiratory therapists. It's a different profession. So for all the suctioning needs and the respiratory needs, I always went to my respiratory therapist, and I was always very thankful for them because they're so knowledgeable. But I don't do that, and you do a lot of that.
I do it all day. That's my job. I love it. Well, here in Switzerland, physiotherapy, there's no respiratory therapists. That doesn't exist. It's only physical therapy that does all the respiratory aspect. And we hear from the emergency room where we have patient with COPD decompensation, where we need to put an IV.
Yeah,
Yes.
No, not an IV, because you don't do
Non-invasive
IVs.
ventilation. Non-invasive ventilation. An IV.
No,
Neither.
an IV goes in your
It's
vein.
not an IV. It's an N-I-V. Well, a ventilation.
You need to put them on a vent.
Oh yeah, exactly.
I'm very skilled in this area.
To help them breathe. We put a machine to help them breathe in the emergency. Then in the ICU we have intubated patient, tracheostomy patient. We have to suction them, make a bronchialis clearance, and also move them. Then on the floor patient we'll have pneumonia patient. We have clearance. Well, even after when they're being discharged, sometimes we have COPD patient that comes to respiratory rehabilitation, so they have to relearn to move and to support effort. So respiratory care here in Switzerland and also neighbor countries, it's really, really, really only the aspect of the physical therapists.
Again, I might be wrong, but I really think that's another one of those things where it's like only in the United States. But I could be wrong.
I don't know. No, maybe not, but in Switzerland it's really...
And so that, going off of that, was something that I found very interesting learning from you, is the fact that you have nights where you're on call.
Yeah.
Where they'll call you in to do respiratory care on patients.
Yes.
I've never heard of a physical therapist being on call and having to go to the hospital in the middle of the night to treat a patient. Never heard of it. If you have heard of that in the United States, I want to know where you work and I want to know your experience, because I was really shocked when you told me you did that. That, as far as I'm aware, that doesn't exist.
Well, it's a little bit... Let's say some huge hospitals, university hospitals, they have a physical therapist 24 hours a day. So at night, the physical therapy is working inside the hospital. But I talk really about huge hospital, and they're just going from a unit to another to just do some airway clearance, to have some suction, and he does that all night because the patient is too unstable to wait until the morning. And in my hospital, which is clearly smaller, we decided that we have on-call physical therapists on the night to put a ventilation in the emergency, who do have some airway clearance when the patient's on the floor. But we don't want to be called all night, so we have some parameters and criteria that the patient has to fulfill, so we go or to the hospital. Because when I'm on night call, I have to work on the next morning at 8 a.m. like a normal day. And when I was called once, twice in the night, it's really hard.
Yeah, and I know like in every hospital that I've worked in, the respiratory therapists work 24/7. So
Yeah.
like in your major hospitals, there is always somebody there for the patients. But it's not the physical therapist.
I like it.